If your child suddenly became tired all the time, started bruising easily, or complained of bone pain, would you know what it means? Most parents don't. Leukemia can hide behind everyday symptoms, and catching it early can change everything. Today, we're breaking down the life-saving signs, tests, and treatments every parent must understand. This is information that could protect your child, or someone you love. Let's dive in. Leukemia. It's a word no parent ever wants to hear, but knowing the facts can make all the difference. Today, we're breaking down what leukemia really is, how it affects children, and the key types every parent needs to understand. Let's walk through this together, clearly, calmly, and confidently. So, what exactly is leukemia? Leukemia is a type of cancer that affects the blood. And since blood is produced inside our bones, in an area called the bone marrow, that's where the condition begins. In a healthy child, the bone marrow creates normal blood cells that help the body fight infections, carry oxygen, and stop bleeding. But in leukemia, something goes wrong. Instead of making healthy cells, the bone marrow starts producing abnormal cells. Cells that don't work the way they should. And the scariest part, these abnormal cells grow out of control, crowding out the normal ones. Once these abnormal cells are created, they don't stay in one place. They enter the bloodstream and travel throughout the body. As they spread, they can collect in organs like the liver, the spleen, or the lymph nodes, and this buildup can interfere with normal body functions. At the same time, the bone marrow becomes so busy making abnormal cells that it stops producing the healthy blood cells children need. That's when symptoms start to appear. Things like fatigue, infections, and easy bruising. Now, there isn't just one kind of leukemia. It can grow slowly, or it can grow very quickly. Slow-growing types are called chronic leukemias, but in children, these are rare. Most childhood leukemia cases are the fast-growing kind, known as acute leukemias. These forms develop quickly and need prompt treatment. But the good news is that over the years, treatments have become incredibly effective. There are two major types of acute leukemia that affect children. The first is acute lymphoblastic leukemia, or ALL. This is the most common type. In fact, it accounts for the majority of childhood leukemia cases. The second type is acute myeloid leukemia, or AML. While less common, it is still very important and requires specialized treatment. Understanding the type of leukemia helps doctors choose the right treatment plan and gives families a clearer picture of what to expect. Spotting leukemia early can save lives, but the tricky part is that its warning signs often look like everyday childhood problems. That's why every parent needs to know what to watch for. Here are the most common warning signs. First, extreme tiredness and weakness. If your child is suddenly exhausted all the time, even after plenty of rest, that's a warning signal that shouldn't be ignored. Next, easy bleeding or bruising. This can show up as frequent nosebleeds, bleeding gums, or unexplained bruises on their arms and legs. Another red flag is frequent fevers or infections. While kids do get sick sometimes, leukemia can make them more prone to infections than usual, or make fevers stick around longer than normal. Bone or joint pain is also common. Some children may limp, refuse to walk, or complain about pain in their legs, arms, or joints. Finally, swollen lymph nodes. These are small, bean-shaped organs you can sometimes see or feel under the skin, around the neck, armpits, or groin. Swelling here can be a sign that something isn't right. Important reminder. Now, it's important to remember that these symptoms don't automatically mean leukemia. They can happen for many other, less serious reasons. But here's the key. If your child shows any of these signs, don't wait. Call your doctor or nurse right away. Early evaluation can make a huge difference in treatment and outcomes. Once a child shows warning signs, the next step is figuring out whether leukemia is really the cause. Testing is the key, and knowing what to expect can make the process less scary for parents and for your child. Regarding first steps, doctors start with the basics. They'll ask about your child's symptoms and take a detailed medical history. Every bruise, every fever, and every complaint matters. It helps paint the full picture. Next comes a physical exam. Doctors check for visible signs of illness, like swollen lymph nodes, pallor, or unusual bruising. This step helps guide which tests are needed next. We will now look at key tests. The first major test is a blood test. Blood tests can reveal abnormal cells, low blood counts, or signs that your child is more prone to infections than normal. The second, and often most definitive test, is a bone marrow biopsy. For this, doctors take a tiny sample of bone marrow, usually from the hip bone, and send it to a lab. Specialists look at it under a microscope to confirm or rule out the presence of cancer cells. It may sound intimidating, but this test is incredibly precise and often the best way to get a clear diagnosis. And here is why these tests matter. These tests aren't just routine. They're life-saving. They help doctors catch leukemia early, determine exactly which type your child has, and choose the right treatment plan. Early and accurate testing can make a real difference in outcomes, and give families the clarity and guidance they need to move forward with confidence. Once leukemia is diagnosed, the next big question is treatment. And here's the important thing. The treatment plan depends on the type of leukemia your child has. Every case is unique, and doctors carefully design a plan that gives your child the best chance for recovery. We will now focus on the main treatment options. Let's break down the main ways leukemia is treated. First, chemotherapy. This is the use of medicines that kill cancer cells or stop them from growing. Most children receive these medicines through a thin tube called an IV line. Sometimes, the medicine is also injected into the spinal fluid to reach hidden leukemia cells that may be harder to treat. Next, radiation therapy. This uses targeted energy to destroy cancer cells. Radiation can be very effective, especially when leukemia cells are concentrated in certain areas of the body. And finally, bone marrow, or stem cell, transplant. Some treatments, especially intensive chemotherapy or radiation, can damage the bone marrow. A transplant replaces those cells with healthy donor cells, giving the bone marrow a fresh start. The donor cells can come from different sources. 1. A matching family member. 2. A matching unrelated donor. And 3. Umbilical cord blood from a newborn baby. And here is what to expect during treatment. Most children respond quickly to treatment and reach remission. That means no abnormal leukemia cells are seen in the blood or bone marrow. But here's a critical point. Even when tests show remission, some hidden leukemia cells may still remain. That's why treatment must continue, sometimes for 2 to 3 years, to make sure the leukemia doesn't return. It's a long journey, but with careful monitoring and support, children can beat leukemia and go on to live healthy, fulfilling lives. Completing leukemia treatment is a huge milestone, but the journey doesn't end there. Even after treatment, careful follow-up is essential to make sure the leukemia does not return. Let's walk through what parents can expect. We will now look at regular follow-up care. Doctors will schedule regular checkups for your child. These follow-ups are more than just routine. They're a way to catch any signs of leukemia early, before it has a chance to come back. During these visits, doctors may 1. Talk with you about any new or ongoing symptoms. 2. Perform a thorough physical exam. 3. Order blood tests to detect early changes. And 4. Occasionally, do a bone marrow biopsy if needed. Let's now consider what parents should watch for. As a parent, you are your child's first line of defense. Keep a close eye on the symptoms we discussed earlier. Things like unusual bruising, fatigue, bone pain, fevers, or swollen lymph nodes. Even after remission, these signs can sometimes indicate that leukemia is returning. Early detection is crucial. Here is when to contact the doctor. If you notice any concerning symptoms, don't wait. Call your doctor or nurse right away. Quick action allows your child's medical team to respond fast and effectively, giving the best possible chance to manage the disease. Follow-up care, vigilance, and early reporting are the keys to keeping your child healthy after leukemia treatment. Being proactive can make all the difference. Even after successful treatment, there's a small chance that leukemia can return. When this happens, doctors call it a relapse. It simply means that some cancer cells have survived and started growing again. Hearing this news can be overwhelming, but it's important to remember, relapse does not mean there is no hope. Modern treatments give children a strong chance to reach remission again. Let's now look at the treatment options after relapse. When leukemia comes back, your child may need additional treatment. The options often include more chemotherapy, powerful medicines that target the returning cancer cells, radiation therapy, used in certain areas of the body where leukemia cells may have collected, bone marrow, or stem cell transplant, often recommended to give your child a stronger, long-term recovery. This procedure replaces the bone marrow with healthy donor cells, helping the body rebuild its defenses. And here is the goal. The main goal after a relapse is simple but vital: to get your child back into remission and keep them healthy. With careful monitoring, the right treatment plan, and a supportive medical team, many children successfully achieve remission a second time. As a parent, staying informed, asking questions, and supporting your child emotionally are just as important as the medical treatment itself. Even after a leukemia diagnosis, parents play a critical role in their child's recovery. One of the most important things you can do is follow the care plan closely. Keep up with every doctor visit, every test, and every instruction from your child's medical team. And if your child experiences any side effects, discomfort, or unexpected problems during treatment, report them immediately. Don't wait. Early communication can make a huge difference. Be an active part of every decision. Leukemia treatment involves many big decisions, like what type of treatment to use, when to start it, and how intense it should be. As a parent, your perspective is invaluable. Always share your thoughts, questions, and concerns with the doctors and nurses. Being actively involved helps the team tailor the treatment to your child's needs and your family's preferences. When your child is offered a treatment, it's okay. Actually, it's essential to ask the right questions. 1. Benefits. Will this treatment help my child live longer, reduce symptoms, improve quality of life? 2. Downsides. What risks or side effects should we expect? 3. Alternatives. Are there other options we should consider? 4. If we decline, what happens if my child does not get this treatment? Asking these questions ensures you fully understand the plan and helps you make informed decisions that are right for your child. Remember, ultimately, informed parents make stronger, clearer decisions, and that directly helps their child get the best care possible. Your involvement, your questions, and your advocacy can make a real difference in your child's journey with leukemia. Thank you for watching and taking these vital steps to protect the health of the children in your life. Remember, knowing the signs, understanding the tests, and staying involved can make a life-saving difference. If you found this video helpful, hit the like button to support our channel, and share it widely, because every parent deserves this life-saving knowledge. Don't forget to subscribe and tap the notification bell so you never miss important updates that could help keep your child safe. And we want to hear from you. Comment below with your thoughts, questions, or experiences. Your story could help another parent take action early. Together, we can spread awareness, save lives, and give every child the best chance for a healthy future. Thank you for being part of this mission. Let's keep the conversation going.